Dr. Viola Pierce. Is it correct? And she's from USA. Welcome and thank you for taking time off to share your presentation with us. Thank you. You may share it.
Okay.
Yes. Wonderful, we've got it. We can see it clearly. Thank you.
Sweet, sweet. So my name is Dr. Viola Pearson. I am the CEO and the founder of VP Nursing and the Nurse Nurturer, where our goal is to equip healthcare professionals to be spiritually and physically fit, financially stable, able to lead with integrity, to decrease error at the bedside, and in leadership, to create resilience, but also to lead a full empowered life. So during the time that we're dealing with all this COVID stuff, it's been really, it's been really tough, right, on the healthcare professionals. It was tough prior to COVID, and it is even tougher as COVID has come in. And so I want to talk about the 5 leadership strategies to maneuver the effects of COVID. So I want you to take this in. 30% of nurses leave their unit or position title during the first year of nursing. So that is a third, almost a third of healthcare professionals. Well, nurses, this is the United States statistics, and I'm sure that it probably is relevant across the world. Leave their positions within, the first year. And we really want to keep those nurses at the bedside, not necessarily keep them at the bedside, but keep them, engaged with the patient, because we want to make sure that we don't have a problem as it relates to hiring staff and staff shortages and things of that nature. So we have to really, really pour into our patient population, right? And so that is what I'm all about. So this started, the way that I became a nurse, I really wanted to be an engineer. Started my career as an engineer, and I want to make sure that I stay with my time. And I think that Dr. Telly she's gonna help me with that. Okay. So I started the career as wanting to be an engineer. But when I started to want to be an engineer, my mom was like, you can't go to school to be an engineer. We don't have that type of money. And so she was like, you got to go to a community college. And I was like, well, why? What am I going to do at a community college? She said, well, I want you to go and be a nurse. She was a nursing assistant. And I was like, well, okay, that's literally how I became a nurse. I've been a nurse for 27 years. And so I went to the community college, went and literally did not even know that you gave Tylenol for fever. I knew nothing about nursing, nothing at all. I was a super healthy child. I was the last of 7 children. And so I was like, well, I don't know what to do. And so I got in there, and there's just huge learning curve. And because it was a huge learning curve, I was only able to make it to the LPN. See, now in the States, what happens is you have your RN degree and you have your LPN degree. Well, at that time, it was an LPN to RN degree. And so I was able to make it through the LPN program, but you had to have a higher GPA in order to make it through to the RN program. So I didn't have that higher GPA. So I ended up staying in LPN for about 10 years. And then I was upstairs on the floor, which is where I worked, because at least in North Carolina, what happens is you have to have you have to be an RN to work in the emergency department, because in the emergency department, all you do is primary assessment, and all you do is. So there's no point in an LPN being down there, which is the restrictions that you have to have on your license. You cannot do initial assessments, and you cannot teach. So I just floated down there one night just to kind of task for the RNs that were down there. Got down to the emergency department, and I was standing back. They were in the triage room, and there was this young girl that came in. She was 16 years old. She came in, she sat down in the chair. The triage nurse started asking her questions, and then all of a sudden, she dropped to the floor. And I was like, oh my God, what is going on? Now, you know how you see something happening and you really want to do something, and you're like, oh my God, you're stuck into place. And the triage nurse said, you need to go and get somebody to help her. So I left and I went to get someone to help us to come back. So as I came back, and we put her up on the stretcher. After we got her and we put her up on that stretcher, we found out that she was pregnant, right? And so I said, oh my God, what's going on? And so we found out she was toxic. She was toxemic. And so we wrapped her up, took her to her room, took her to our trauma room, and then we called her mom in there. When we called her mom in there, her mom was like flipping out because she didn't know that she was pregnant. And so the physician was like, look, you have got to get yourself together. You have got to get yourself together. And so I was like, Lord, these are my people. I really like this. And so that was the thing that was the motivation for me to go back to get my RN degree. So I went back to school, got my RN degree, BSN, master's, and then of course my doctorate degree. But much of the years I've worked in the emergency department. So the first, this particular, for years and years and years, I really had a good time working in the emergency department and never really had any problems with it until I would go on vacation and I would come back and I would always want to come back to work. But then after a while, I just didn't want to come back to work anymore. And I didn't understand it. I didn't understand that what I was going through was burnout, basically. Well, this particular month is the month that really changed the trajectory of who I am and what I was to do. So this particular month, what happened was I came in, my shift toggled because I needed to go to, and I was absolutely adamant that I wanted to go to church. And so I worked weekends because I got paid more money to do on the weekends what they got paid to do during the week. And the two subsets of patients that I like to take care of the most is the patriarch and the matriarchs of their families, and also the children between the ages of 2 and 6, because before 2, they cry too much. After 6, they talk too much, right? And so I said, well, okay. So I come in, and the first weekend I walk in, and there's a child that's a fatality due to gunfire. The second weekend I come in, and there's another child between the ages of 2 to 6 that is a fatality due to gunfire. The third weekend, nothing happens, and I'm like, thank you, Lord. But then the fourth weekend happened, and this is where life changed. I walk in, and there's a child that's a fatality due to play because he didn't understand the dangers of his play. I walked past, he walked past the, whenever a kid walks past a body of water, they don't understand that if you jump into the water that you need the skill of swimming in order to be able to survive it. They don't understand that whenever you walk past grandma's medications, that they may look like they're candy, but they're not. They don't understand that there's a line of demarcation between the road and the yard, and that line is called the curb. And if they cross over that line, then the numbers go up exponentially high that they will be killed. He didn't understand the dangers of his play. And then the patriarch of his family came in, and he had a AAA. And as we all know, whenever a patient comes in with a AAA, typically that patient does not know about the disease process, number one. Number two, they are talking to you, which changes the game of the relationship between the nurse and the patient. The patient came in, and he was talking to us, but his AAA was widening. And he ended up dying before he left there. So we had these two patients. We had a patient who was, the youngest patient of the family, and the patient that was the oldest patient of the family, and they had just died. And when I walked out of the room, I literally was tore up out of my frame because we've lost just two patients that are amazing. I walk out of the room and I look across the emergency department, and I see people who are upset because they were not first, when they didn't know that not being first in the emergency department is not like being first in the Ticketmaster line. They didn't know that not being first in the emergency department is not like being first in the line at Walmart during Black Friday. And so I had to go with one of the family's members to the room. I went with the child's family, and we told them something that would change the trajectory of their lives forever. And so we left there, and I walked out to my truck, and I toggle to songs that are very mellow, but this particular night I toggled to a song by Kirk Franklin and Toby Mac, and the song was Be Still and Know That I Am God. And that song was a song that literally was the spiritual foundation that I needed in order to go back to work the next day, because normally I wouldn't have went back to work the next day. I struggled with just continuing on in the profession. When in this profession, while we're in this COVID situation, the numbers don't lie. I mean, there's well over 150,000 patients in the states that have died as it relates to COVID. And then that's tough. That's really tough. When, I heard in 1 month, I heard 4 codes. They hear 20 codes in one day, and that's not easy for them to be able to maneuver that. But it's all about mastering your breaking point and understanding that God has a bigger plan for you. And that's what I had to understand, that God just had a bigger plan for me. And then getting past barriers, okay? Because I, as an African-American female, I was born in 1972. I was born right on the backside of our civil rights movement here in the U.S. And because I was born on the backside of that, I really honestly thought I really thought black and white, and this is not that type of conversation, but I really thought it was white male, white female, black male, and then black female. And I had to scrape and scratch in order to get to where I needed to be. But you know how you are when there's certain significant things that happen in your life, and you know where you were when those things happen in your life. And so I remember when 9/11 happened. I was in the hospital, and I was looking at the TV, and in my young mind, I didn't really understand what was going on. But I was like, well, what in the world? How was that? How was that going on? And so I looked at the TV, and the lady who was standing beside me, she said, we're being attacked. And even then, I wasn't able to really understand the whole, what exactly was going on, the full resolve of what was going on. So when I remember it's those moments that that shape your life. And so the moment that I found out that Oprah Winfrey was a billionaire, it shaped my life. It changed the way that I thought. And I remember I was rounding the little waterfalls at the hospital, and I was rounding it, and they said that she was a billionaire. And I said, a billionaire with a B, not with an M. And then I was like, well, if she can do that, then I can do that too. And not that the goal was to do that, but the goal was to know that we can do anything. And so once I knew that my story was that I struggled in healthcare, I'm not the only one. The average life of an ER nurse is about 5 years. And that is a lot of expertise that we don't need to be leaving the bedside. And so I knew that I could change the trajectory of healthcare, change the face of healthcare as we know it. I just had to have it in my mindset that I would be able to do it. Now, these COVID deaths are causing a lot of pain. And so we need to be able to maneuver that. But we need to have as healthcare professionals, we need to have it on our outside lives in order to be able to maneuver it on our inside lives as it relates to healthcare. So I'm sorry. So our 5 pillars of success is family, fitness, finance, spirituality, and leadership. Okay. And Maslow's hierarchy. At the basis of Maslow's hierarchy is physiological needs. And physiological needs onto safety needs, loving, belonging, esteem, and then self-actualization. Self-actualization is kind of where I'm at right now, where I understand that I have a purpose and a plan to change the face of healthcare forever, for the way that it is to be, along with the health of these amazing people who are on this call. Okay, so physiological needs, and of course Maslow, we all know who Maslow was, but that is the basis of it. And so we need to really understand that. I really think that under physiological needs, the spiritual needs, because once you connect with your creator, whoever your creator is, we're a faith-based company. So once you connect with whoever your creator is, then your spirituality means a lot more than your physiological needs. So spirituality is where we start. So I start and end my day with God. every single solitary day. Now, whether it's a higher power for you, or whether it's, whoever your God is, that's how I started in my day. I remember at the beginning of May, which normally it starts to get warm here around March. Beginning of May, it was still really cold here. And I was like, Lord, what's going on? Why is it still cool here? And he, and of course I said, I know that there's people that, are, intent on, not you keeping it cool, but I would like for it to be warm, Lord, if you could answer my prayer. And I think a lot of times what people think is that they need to come to God with some elaborate, well thought out prayer and well thought out sayings. And the reality is that you don't really need to do that. You just need to come to God and have that connection with him. I also have a prayer partner, and whether it is you coming together with someone else and having that spiritual connection with them, because whenever you come to the bedside and whenever you struggle with those traumatic instances, you have to have some way of dispelling that. This is the way that you dispel that. Now, the prayer partner is a young lady that we kind of came together out of adversity. Our children were acting a little foolish, and so we came together out of adversity, and we started praying. We pray every Thursday. We don't have time to pray every single solitary day with each other. We have our own individual prayer time on those days. But on every Thursday, we come together and we just pray. And it's ever evolved from this point forward. We've started praying. Then gratefulness. Gratefulness is super, super important. I remember in gratefulness, and when I'm talking about grateful, I'm talking about grateful for things that 10 things under $10. I remember I was I have a website. One of the things that we had been doing is that we were giving away gifts as a lead magnet. And so we were giving away the gifts, and one of my friends actually won one of the gifts. And so I called her up and I was like, hey, I was like, you want a gift? And she was like, okay. And so during that same day, I found out that her son had graduated high school, and her husband it was their wedding anniversary, all on the same day. And so she was like, it's bittersweet. And I was like, what's bittersweet about it? And she said, well, I'm getting older. And I said, well, it's old or dead. So it's okay, right? It's okay for you to be grateful for this day. She said, okay. And so what she did was it changed her perspective, right? Because you have to have that perspective of where you're going. It can be either your prison or your passport. In either one of the two. I remember that I used to think that I couldn't. Once I figured out that I could, life changed for me. And so we can go into the healthcare arena, and we can go in there, we can say, well, it's a broken system and we're never going to change it. We're never going to change what happens within the healthcare system. But the reality of the matter is that we're a bunch of smart people, and we can change the way that it is done. We can change the way that things are being done. And unfortunately, we have to have the mindset for it, though. And these are the things that we have to talk about in order to get the smart people in the room, in order to get the intelligent people in the room, in order to get them at that table so that they can work it out for us. And then laughter. Everybody needs to laugh all the time. That is something that I'm super, super, all about. You got to mind what comes into your eye gate and your ear gate. And what I mean by that is that what you see and what you hear. I have an issue. So my child, he likes this show that's on Netflix, and he likes it, but it's kind of demonic. And so I just can't look at that all the time, because I have to look at things that make me laugh, that make me light, that make me happy, because I really, really want to make sure that I take care of my mental health, because my mental health is super important. The thing about it is that you have to put the oxygen mask on yourself. You cannot go. I remember I went to, we were on our way to Louisiana, and we were on our way to see my brother, and it was the second plane ride that I ever had been on in my entire life. And my little girl was a year old. And when I was pregnant, I had all this nausea, vomiting. I mean, just round ligament pain. You can't take no medicines because of the fetal anomalies. I mean, it's just crazy. So I remember on the plane going to see my brother, and I sat on the plane, and the lady, she came over the overhead, and, you know, she says, you know, whenever if you have a child with you, I want you to put the oxygen mask on yourself first. And I thought, well, she doesn't understand. She doesn't understand what I had to go through for me to get this child into this world, because I wanted 4 children when I first started, and I only had 2 because I couldn't, that whole pregnancy thing was not for me. And so I was like, she didn't understand what I had to go through. And I don't know whether she's had a baby before or not. But when she said put that oxygen mask on the baby, she didn't help me to understand the reasons why she wanted me to put the oxygen mask on myself first. Well, the reason why she wanted me to put the oxygen mask on myself first was because she knew that if I can't take care of myself, then I will never be able to take care of a patient, period, my child, period. And that is the case with this. You cannot take care of a patient if you don't take care of yourself. This is what my company is all about. This is what we bring to the table. We bring a specific quality of life for the healthcare professional, because the healthcare professional is the most important thing. As a CNO, Chief Nursing Officer, or as a CFO, CEO, you will never be able to touch every patient, but you will be able to touch every staff member. You pour into your staff members, and your staff members will pour into your patients. Here in the United States, we are get reimbursed because of patient satisfaction scores, right? And so there's a huge pull on making sure that the patients are okay. Well, the staff have to be okay also. So next is finance. Now, I am, you know, this is a very basic financial lesson. First is tithing. You know, I'm a huge believer in giving back. I believe that we tithe 10%. So I don't believe if you can't live off of 90%, that you can't live off 100%. So tithing is super important, because God said, if you, I'm a Christian, and so in the Bible it says that if that He will pour out a blessing that you won't have room enough to receive. Budgeting is hugely important. Understanding you need to tell your money where to go. If you do not tell your money where to go, your money will go where your money will want to. Stop using credit cards. They're just never good. They have those interest rates. They're there to make you poor. So stop using them. My goal is to never ever use another credit card. Debt dumping. Now, debt dumping is whatever debt you have, you want to dump that debt. So if you have $1,000 bill, you have a $2,000 bill, and you have a $3,000 bill, you want to start on that $1,000 bill. Some people say that you need to start on the bill that has the highest interest rate. Some people say that you need to start on the one that has the lowest limit. I believe in the lowest limit because it gives you that mindset that, you know, that satisfaction. So you start on that $1,000 bill, and then you pay $100 to that, or however much you're normally paying to that, how much you can pay to that. If you can pay $100 on that, you get that paid off in 10 months, right? 10 on 10, right? So 10 months. After you do that, and you take that $100 that you have on that first bill, and you apply it to that second one. And then you continue until you can completely pay that one off, and then so on and so forth. Because you want to completely dump your debt. Because whenever clinicians come to the bedside, you want them to be able to be in tune to the patient. And if their car is getting repossessed outside, or there's a fear of their car getting repossessed outside, then they're not going to be paying attention to that patient. Now, another thing that they need to do is to write down what they spend for every single solitary month. You want to make sure that their expenditures, they understand where their money is going. And they should do this probably about every couple of months. And then saving 3 to 6 months worth of income. Making sure that because here in the United States, what happened was we had the hot spots for COVID, and then you had the cold spots for COVID. Well, what happened in the cold spots, you know, the people that were in the hot spots, they were being worked to death, right? But then you had the people who were in the cold spots, they weren't working at all. And so when they weren't working at all and they were getting laid off, then you had their money wasn't coming in. Healthcare is normally very stable. You can get a job in healthcare anywhere, right? But then it changed the trajectory of how things were happening. And so that 3 to 6 months of savings gives you the ability to be able to, navigate those waters. Steve Harvey said that having money is the difference between an emergency and a mere inconvenience. And so if your HVAC, your heating and air conditioning system goes out and it costs $5,000 and you got $5,000, and it's just a mere inconvenience to wait for the person to get there to change out the system. But if you don't have that $5,000, then what happens is you are struggling and you don't know, because I went from bankruptcy to a credit score of over 800. Okay. And I came home. I came home one day with my baby in my arm and walked into the house, and it was dark and it was cold. And I had to borrow money from place to place in order to get me to where I needed to be. And this may not be something that you on this call need to understand, but at the same time, as leaders in your organization, these are things that your healthcare professional should know in order to be able to navigate the waters of this whole COVID situation and as a general rule in life. And of course, life insurance policies. I struggle with people who have these GoFundMe accounts for life insurance for, after they pass away, their family have the GoFundMe accounts because they've not prepared for that. And there's 2 types of life insurance policies that I typically, talk about. And there's the whole life, okay, which you got to pay a whole bunch of money for that. And then there's the term life, right? So term life, you don't pay as much money, but you only term it for 20 years, because during those 20 years, you're wealth building. You're building your wealth in order to get you to where you need to be in order to make sure that when you die, then they will have legacy from you. Next, fitness and health. Now, I like exercising. And when I first started exercising, I started running. Now, I don't necessarily like to run anymore. I will do it, but I do exercise. There's a couple of things about exercise that we all need to know. In order for the healthcare professional to be able to run to these codes for these COVID patients, they have to be healthy. They have to be healthy. They have to be in top shape. Period, point blank, end of story. And so we have got to give them the tools that they need in their toolbox in order to be able to navigate these waters. So one thing that I say about exercise is that I'm not going to do an exercise that I don't like to do. And I said that I won't do planks, but the other day, because I had this personal trainer, he made me do planks. But I hate planks, right? I just don't like them. And so, but I exercise, and I do the exercises that I like to do because I'm more apt to do them, okay? The second thing that I do is I make sure that I am with people that I like to exercise with. And I have these accountability partners. So I'm in a couple of exercise groups. And so, they'll put out, are you going to work out in the morning? And we'll go and we'll work out in the morning. Those are the types of things, having that accountability, or exercising in the way in which you like to exercise is super, super important. Eating clean, wholesome foods. Makes such a difference. I cannot tell you how different I feel whenever I do eat the clean, wholesome food. So, and I say, eat the perimeter of the store. And so, here at Walmart, we have the fruits and vegetables, you have the meats in the back, and then you have the milks over to the side. And some people don't think, and I have to agree with them, that milks is not necessarily healthy for you, but maybe the almond milks or the almond milk or the coconut milk. I love coconut milk. And so coconut milk and, the meats at the back of the store, and just making sure you do that, because the stuff that's in the middle of the Walmart, that stuff is typically not healthy. I mean, I love a Cheeto, right? I love Cheetos. They're really, really good. But I don't think that I can't trace them back to a plant. right? I can't trace them back to a source. So, and then keeping track of your calories. One of the things that I do, and I'm super, I absolutely try to do to understand, what is his name? Anthony Bourdain. He's unfortunately passed away. He killed himself. But he used to be a guy that was on the show in America here, you know, on I want to say CNN. I'm not exactly sure, but anyway, it was a cooking show, and he would go to all these restaurants, and he said the reason why the restaurants have these foods that taste so good is because they put a stick of butter in everything. And I was like, is that the reason why the food's so good? Is that the reason why I like eating out and I don't like eating my own food? But he said that that's the reason why. And so understanding that those foods are higher in calories most of the time, and understanding what your calories are, so that whenever you go to choose the foods, that you understand what kind of calories are in those foods. Super important as it relates to COVID. Now, this is family love. Now, I have to tell you that I hadn't always gotten this right. And I don't think a lot of people have always gotten this right, right? So agape love. Agape love is that unconditional love. That unconditional love that you need to give to your family no matter what. And so, you know, sometimes they're not going to do the things that you want them to do. But life is 10% of what happens to you and 90% of how you react to it, period. And so you can't, you know, children between the ages of, especially girls, right? You know, they get to about middle school and you're like, oh my God, they are acting pure crazy. And then, you know, I think the point of them acting crazy at that point is so that you are able to say, okay, you can go and live on your own now. I'm good with you living on your own, because they will drive you to the brink of insanity. But that agape love, understanding that they're going to eventually come back. They're going to eventually get to the point where they going to love you again. But what you're doing is you're teaching them how to treat you, number one. Number two, you're teaching them how to love, how to give that love away. We have to also do it with our patients, because what happens is our patients come into the fray, and they're at their most vulnerable state. And so we have to understand that we have to love them. Now, we're not going to let them, you know, chastise us and, you know, be ugly to us, but we have to love them with that agape love. Loving without overflow. You have to understand, to love yourself, in order to be able to love someone else, you have to be able to love yourself with your overflow. And so one of the things that I know for a fact is that I can't love you better than I love me, no matter how hard I try. I can try until I'm gray in the face, but I can't love you no more than I love myself. Forgiveness. Understanding that when you don't forgive, I used to be, when I was younger, I could hold a grudge for years. If you did something to me, I would remember it forever. But then I had to understand that you were hurting, and that my forgiveness was for me, and it was not for you. It's for me to give to you, because when you're unforgiving, T.D. Jakes said that it's like eating the poison and expecting the other person to die. And that is not what we want to do. Praising more than scolding. Now, I have to tell you a story about my grandson. So we went to school one day, got in school, and I got him. I picked him up from school. He's 4 years old. I picked him up from school, and we were on our way home, and I was like, do you like school? And he was like, no. Every day I would pick this little boy up. He was like, no, I don't like school. And I was like, why don't you like school? And he was like, I just don't like that school. So I tried to change the narrative at the end of the day. And I tried to start saying to him, you know, say that you like the school, but I don't like the school, is what he would say to me. And so, you know, I would, every now and then I would take him to school. I'm not his parent, so I didn't take him to school every day, but every now and then I would take him to school. And every time I would take him to school, I would get down real low with him. And I would say, Taylor, I would say, look, say this with me. I will have a good day. And we would say that three times. And he would say, okay. And then I would say, I want you to say your name is Dr. Taylor, his last name, right? And he would say, okay. And so at the end of the day, when I start picking him up, I'd say, did you have a good day, Taylor? He said, yes, I had a good day, Gigi. And I was like, yay, we're good. We're good. I'm super excited. And so now, and not that I want him to be a doctor or whatever, but I want him to understand that his life is limitless. It's the same way when it comes to your staff. It's the same way when it comes to your patients, giving them that praising whenever they do what they're supposed to do, understanding, praising them more than you scold them, understanding that you have to scold them at times, or you have to reprimand people at times, not necessarily scolding, but reprimand them at times, but you also want to praise them more than you reprimand. Creating legacy within your family, understanding that you're not just here for you, you're here for the generations to come. And that right there is creating that legacy. Communicating often. Now I have a 17-year-old boy who absolutely does not communicate. So I have to figure out ways of communicating with him. Within your team, you have to figure out ways of communicating with your team. And you also have to figure out ways of communicating with your patients. Patients, what I have found out is that I have to find some, nuggets somewhere where I can connect with them. They don't necessarily connect with me in every way, but finding out something that I can connect with them, usually by giving them some type of compliment, whatever the compliment is. Like this one girl, she came in and she was highly upset because of her weight in the emergency department, which I understood, right? But she came in and she had on these cute little red shoes. And I was like, well, you have on these cute red shoes. And that completely changed her demeanor, because I was trying to communicate with her. I was trying to connect with her. I was trying to give her what she needed. Leadership. This is where the buck stops. Because you're on this call, I know that you are a leader. Be clear on that. I'm very, very clear on that. And so because you are a leader, and this right here is for you. First, you have to have a vision. And I think that your vision, I used to always think that my vision for my life should match my job, right? No, I don't think that any longer. What I think is my vision for my life, my job should match my vision for my life. You have to have a vision for what goes on. So the CNO and the CEO of the organization needs to have a vision for the entire, for the year, right? The managers and the directors need to have the vision for their units, maybe monthly or, longer than that. And then the charge nurses on the unit need to have the vision for the day, for the scope of the day, and help carry that vision out. You have to understand, if Jim Rohn said that if you don't have a target, you're going to hit it every time. If you're aiming for nothing, you'll hit it every time, right? And so that is where your vision comes in. But also having a vision for your family, because at the end of the day, you want to make sure that your family is good. You want to make sure that your life is good, and having that vision is super important. There's a thing called the law of the lid, and this is a John Maxwell concept, okay? And the law of the lid means that your organization can never go higher than you are, all right? So what this basically means is that if you are a 5, your organization can only go to a 4. If you are a 6, your organization can only go to a 5. So he said that he was talking to this guy who revamped resorts. And he said that they were having a conversation, because he would always make sure that he was coached by someone who was doing things better than he was. So he went and he talked to this guy. And so he sat down and he talked to him. He was like, well, what do you do whenever you go into the resorts? He said, I always do 2 things. And he said, what are those 2 things? He said, the first thing that I would do, he said, is I would make sure that the frontline staff was trained on customer service. And he said, okay, that's good. That's good. And he said, the second thing that I would do, he said, is I would make sure that the CEO was fired. And I was like, what? And John Maxwell was like, what? The CEO fired? And he was like, yes. He said, because you can never go higher than what your CEO is. He said the reason why they're struggling is because their CEO is not being effective in what they need to do. And so one of the things that during Corona is that I appreciated, at least for my organization, is that there was a whole lot of communication. Because what happens is when you're in an sure situation, sometimes you kind of cower back in the corner because this is not something that we've ever dealt with before. But you don't want to cower back in the corner. You want to communicate often and make sure that your staff is heard. Make sure that you answer their questions, with whatever knowledge that you have, because as a CEO, you probably have a little bit more knowledge than everybody else does. As a CNO, as a charge nurse, you probably have a little bit more knowledge than your staff has. So you need to understand what you need to do in order to be able to communicate. Emotional intelligence. Your message may be accurate, but your timing could be off. I remember I had one staff member, and it was just not too long ago, actually. She said she was sitting back, and one of the staff members tested positive for corona. And she was like, well, I would shut that, everybody was upset about the fact that they were, exposed to this person. And she was like, I would shut that down. I would just shut that down. Well, you can't shut that down, because those are those feelings. And those are those things that you want to be able to answer to that person who comes into your space, be able to answer whatever they have, because as long as they feel like thank you, Miss Kelly. As long as they feel like they're heard, then you're good. Managing your tongue, that is super important. Make sure that you manage this little thing that's in your mouth. Because as leaders, what happens is you have, your tongue it can either make you or break you. Never play the blame game. Never blame anybody else for the situation that's going on. You need to take responsibility as a leader of the organization. I mean, we can blame Corona, right? But, not blame anything else, right? But at the end of the day, it's like it's an invisible enemy, and we just need to figure that out. Beware of the crab in the barrel mentality. There will people, as you go up in leadership, as you do whatever you need to do, there will be people who will try to pull you down. The crab in the barrel, and I didn't understand this at first. So what it means is that there's crabs in a barrel. Every time a crab tries to get out of that barrel, there's crabs that will pull them down. Every time another crab tries to get out of that barrel, they'll try to pull him down. He keeps trying to get out, they'll keep pulling him down. And after a while, he's like, I just don't want to get out of that barrel anymore. Beware of that crab in the barrel mentality. You are amazing, and you will change the face of healthcare as we know it. And so beware of that. So I want to read these two poems to you. Being a nurse, and I know everybody's not a nurse, but just put your profession in there. Being a nurse means you will never be bored. You will always be frustrated. So much to do in so little time. You will step into people's lives and you will make a difference. Some will bless you, some will curse you. You will see people at their worst and at their best. You will never cease to be amazed at people's capacity for love, courage, and endurance. You will see life begin and end. You will experience resounding triumphs and devastating failures. You will cry a lot. You will laugh a lot. You will know what it means to be human and to be humane. And then this is the care worker. I wake them up. I get them dressed. I brush their hair so they look their best. I make their bed and wash their clothes. The little things that no one knows. I hold their hands when they are scared. I talk to them when no one's there. I give them a friend when they are alone. I treat them like family, one of my own. And when it's time to save a life, I keep my heart strong and hold my head high. I wait till it's over when everything's done, when the house is gone quiet, the emptiness comes. So please don't judge me when you think I don't care. I look after your family when no one's there. Now, my name is Dr. Viola Pierce. I am the CEO and the founder of the Nurse Nurturer MVP Nursing. And you can send me, you can contact me on my website at www.v as in Victor, P as in Paul, nursing.com. I can come into your organizations virtually or not and help your healthcare professionals reach the maximum of their lives so that they're able to show up. They're able to decrease error, number one. They're able to show up exceptional at the bedside so that you and your organization can thrive. Any questions?
If there's no questions, I would just like to make a comment, Dr. Viola.
Okay.
You know, sharing your history of how you became a nurse, I can so much identify with that. Because I always say I landed up in nursing accidentally. But I know in the end that that was God's plan for my life. Because this is where I found love, I found everything that fulfillment, I would say. And so therefore, I really can identify. And also based on your presentation on this COVID and the many deaths, with regard to my thesis, it was also about the many deaths that nurses have to face. And so I just want to say thank you for that presentation, and what our nurses and healthcare workers in specific is going through at this present moment is very sad. We are once again faced with trauma that we need to have a foundation and the means and ways of how to deal with that trauma. If there's no other questions or no other comments for Dr. Viola, I would like to thank her then very much for everything, for the presentation. It was very touching, and we've got a better idea of what is happening now. Yes, Mr. Tongi, have you got a question?
It's not a question, but you did say questions or comments. That was phenomenal. Thank you so much, Doctor. I took a heck of a lot from that, if only because you mentioned about finding the Lord and asking the Lord for things and the Lord looking out for you. And that actually happened to me. I was actually struck by a car traveling at over 80 miles an hour. That was whilst I was outside of my own car. And you don't survive that. The only thing that let me survive that was somebody up there looking after me. And I thank you so much for bringing that back into the forefront of my memory again. Thank you.
Thank you. Thank you for sharing that story.
Thank you so much, Mr. Tongi. Can I just say that unfortunately we were supposed to have a last presentation by Dr. Lauren Frost. Presentation was on development of an educational intervention to decrease sedentary behavior in an adult family practice population, but due to family emergencies, it's not able to do the presentation, but the presentation will be available on YouTube, like all other presentations. So if you have time, then you can go and listen to that presentation. And you know, we've come to the end of this conference, and from my side, I can just thank everybody that participated in the conference, that have given up your time to be able to present at the conference. So from UCG, I would like to thank everybody that participated, and even your family members that had to give up their time that you probably had to spend with them for you to be able to be here and presenting your research or your paper, what you presented here to us. And I must say, I've learned so much these past 2 days. And from my side, I'd like to thank everybody once again. And I can't say travel back home safely, because I believe we are all in our homes. So thank you so much, and God bless, and may good luck with your future endeavors. And once again, thank you, UCG, for this opportunity that you've given us all to come and share. And from my side, to be a host and to be a chairperson, this was it was a learning curve for me, and I've learned a lot. And I want to also thank Mr. Tongi, who has shared this platform with me. And I don't know if you would like to say a few words, Mr. Tongi.
I would like to express my deepest thanks to the organisation for allowing me to attend the conference. Whilst I've done a little bit in assisting, I hope, by being a partner in crime with yourself, Dr. Telly, and being a co-chairperson, I've taken a lot from this conference. It's been wonderful. Thank you so much. And thank you to all of the attendees and, in particular, all the presenters from whom I have gained a lot of knowledge.